Professor Mohammad Sultan Khoro, Director, Digestive Diseases Center, Srinagar, Professor Abdullah Bebani, Vice President, Kuwait University, Dr. Vidat Al-Nakib, Professor of Virology, Faculty of Medicine, Kuwait University, eminent dignitaries and family of IDF. Welcome to KMA-IDF Oration 2008, Discovery of Hepatitis E virus, the epidemic non-A, non-B hepatitis 25 years later. May I now invite Dr. Ramesh Pandita, our charismatic and able president, to render the welcome address. Dr. Ramesh Pandita.
His Excellency, Mr. M. Ganapati, Ambassador of India to State of Kuwait, Professor Abdullah Bebahani, Vice President, Kuwait University, Dr. Ahmad Al-Shati, Director of Health Ministry of Public Health, Professor Mohammad Sultan Khuru, Director, Digestive Diseases Center, Srinagar, Professor Vidat Al-Nakib, Professor of Clinical Virology, Faculty of Medicine, distinguished guests, ladies and gentlemen. IDF started KMA-IDF Oration 2 years back. This was done primarily to salute and to commemorate the historic brotherhood and relation and friendship between Kuwait and India. This oration also gives us a chance to honor outstanding physicians from India who have made substantive contribution in the field of medicine. Today, we are on the 3rd annual KMA-IDF Oration. The recipient of this oration is an outstanding physician, investigator, and a medical teacher. He has made outstanding and pioneering contribution to the field of gastroenterology, especially in the field of hepatitis, hepatobiliary pancreatic parasitic disorders, and management of upper GI bleed. Ladies and gentlemen, please welcome Professor Mohammad Sultan Khuru, the recipient of KMA-IDF Oration 2008.
Excellency, the Ambassador of India, Sri M. Ganapati, Professor Abdullah Bebahani, Professor Vidat Al-Nakib, Professor Mohammad Sultan Khuru, other dignitaries in front of me, friends and colleagues, my IDF fellows. It gives me great pleasure in introducing Professor Mohammad Sultan Khuru as this year's recipient of KMA-IDF Oration. It had been a very big task in front of the selection committee to choose this exceptional person, and with a lot of effort and brainstorming, this great individual was selected for this award. Professor Khuru had his MBBS and later MD in internal medicine in Medical College, Srinagar, India. He had very brilliant academic career, and he was the best outgoing student and received several gold medals. He joined the Department of Medicine there. Later he joined Postgraduate Institute of Medical Education in Chandigarh for his super specialty training DM in gastroenterology. During the training, he showed his extreme leadership in research, and at that age, he described for the first time hepatic vein thrombosis following pregnancy. It was one of the coveted articles which came out in American Journal of Medicine in 1980. He returned to Medical College, Srinagar, where he started his research, educational and professional career. At this time, he discovered hepatitis E as a new disease entity and spent almost 15 years to see the intricacies and the significance of this organism. This discovery of hepatitis E brought him several national and international awards, recognition, and a lot of fame. Classic papers in viral hepatitis were published in 1992 with his name on the top. Professor Kuru took the chair of the Department of Medicine and Gastroenterology in Sher-e-Kashmir Institute in Srinagar in India, which is one of the covetous institutes there. He established the Department of Gastroenterology with superb clinical, investigative, teaching and research facilities. It was at this time he discovered the unique entity of hepatobiliary pancreatic ascariasis. He did a lot of extensive research and epidemiological studies in gastric cancer, esophageal cancer, gallstones, and peptic ulcer. He collaborated a lot of research activities with several international institutes, including National Institute of Health, Bethesda, Maryland, and Center for Disease Control, Atlanta, Georgia.
Please come on stage to receive the award. Thank you. Professor Abdullah, if you could please give the KMA-IDF Oration Award a plaque to Professor Kuru. Thank you, Professor Abdullah. His Excellency, Mr. Ganpati, to please present KMA-IDF Oration Cash Award of 100,000 to Professor Kuru. Dr. Pandita, if you could give a memento to Professor Kuru.
Professor Muhammad Sultan Kuru, Dr. Abdullah Bebewani, the Vice President of Kuwait University, Dr. Vidad Al-Naqib, Professor of Clinical Virology, Dr. Ahmed Al-Shatti, Director, Ministry of Health. I think Dr. Ahmed Al-Fadli has still not made it, but I can greet him in his absence, Vice President of the KMA, Dr. Ramesh Pandita, the President of IDF, Dr. Nampuri, the advisor, Dr. Amir Ahmed, the Secretary General, esteemed Kuwaiti doctors and professors, esteemed members of the Indian Doctors Forum, friends, ladies and gentlemen. May I first of all warmly congratulate Professor Muhammad Sultan Kuru for being this year's KMA-IDF Oration awardee. It's a well-deserved recognition, and the calibration of this oration increases and improves every year. I think this is the third such oration. The first one, I was present. The second one, India made me miss it. The third one, India made me nearly stay back, but I said I can't miss it. I had to be here. First of all, of course, I would like to convey our warmest gratitude to the Kuwait Medical Association for making IDF a part and parcel of its August portals. Because in every country far away from home, you need, as they say in India, chhatra chhaya, or a shelter. And I think the KMA deserves our gratitude. Talking of the IDF, this is one organization which has done exceptionally well in bringing about cheer and joy to many in the community and beyond. I have been lucky right from the day I landed, literally. I think I landed on the 5th of January 2006, and 6th of January I was literally present at the Doctors' Fest of the IDF, and I have considered it a privilege and honor to be present at each and every function when I am in Kuwait, that is, of the IDF's activities, be it the seminar, be it the medical camps, be it any other such special function or the oration. And I would like to congratulate the members of the Indian Doctors Forum for being the standard bearers and flag bearers of India in this warm and friendly and hospitable country of the state of Kuwait. Thank you very much to all the members of the IDF for making this possible. Of course, today's function is a recognition of Professor Mohammad Sultan Khuru's achievements over the years. And I think in my brief chat which I've had with him, I think this is a well-deserved recognition which the IDF had thought it fit to award, because I think the field of medicine today progresses, but there is a lot of unknown beyond. And Professor Khuru, what I have seen briefly, because for me it's all Greek and Latin. I think the doctors give me doctor. Today Dr. Pandita called me a professor, but I say I'm just plain neither a doctor nor a professor. But what I see in the roll of honor, which has been produced in this small paper, I think it is tremendous work which you have carried on for the good of humanity. And we saw, I think 2 years ago, 2 doctors received the Nobel Prize for discovering the H. pylori. I think we hope that the KMA-IDF Oration would be an add-on to what you have so far got and what you would get in the days beyond in recognition of the singular contribution to the service of medicine you have done. I think with these words, I also would like to say that when I see a full hall, it also reflects very well on the organizers of the function. And today's function is a singular recognition of this fact, that it is a recognition of the KMA, it is a recognition of the IDF, and it is a recognition of the contribution which the esteemed speaker, the distinguished dignitary, will make in the minutes beyond. Thank you very much, Professor Khuru, for sparing your time, for coming from the paradise on earth in India, as they say the state of Jammu and Kashmir is, to this wonderful place which Kuwait is, and giving us the benefit of your wisdom today evening. Thank you very much, and I'm sure everyone will enjoy today's evening. Thank you very much, and all the very best. And congratulations to you, Professor, once again.
Ambassador of India to the state of Kuwait, Professor Khuru, our honorable and renowned scientist, dear friends from India and Kuwait, unlike what Dr. Bandetta said, I'm not an extraordinary person at all. I'm just an ordinary individual who has a little extra love for India. It is really a pleasure to share with you the joyful experience of this occasion and share with you the celebrity in tonight's festival. It's also an opportunity for me to express my admiration that I carry in my mind and in my heart for the leaders and the members of this fine forum, and in recognition to their good turns. Your achievement has been remarkable and challenging to the pace of time, and you should be proud of it, as I am. It is also very good thoughts of you to bring the best of India to us here, Professor Khuru. Because it's good to be recognized, and it is best when this is done by colleagues and peers who belong to the same profession. We all dream or wish that this is realized for each and every one of us.
Your Excellency, Professor Babhani, and everybody, ladies and gentlemen, it's really a great honor to be invited to basically honor Professor Huru for his achievement in the field of hepatitis. I was asked to give just an introduction to the topic, and I want to go back to the days of my training at St. Thomas Hospital Medical School. When I joined them, we just finished, hepatitis B was just discovered. And Professor Dane in the Middlesex Hospital saw the virus, the Dane particle, the 42 nanometer virus. And we just began at the time to develop a gel diffusion assay to pick up the virus in the blood. You can imagine how far we've gone since then. And the way we used to do it is simply try and collect as much blood as we can from carriers of hepatitis B, go inside basically a cold room, and through gel filtration try to concentrate the virus. And once we've done that, we're able to use that concentrated virus in gel diffusion to be able to pick up basically antibodies. Now, that's when we began to identify this antigen-antibody reaction between the virus and antibody. And this ultimately led to the assays that picked up the virus in the blood. So that was a major contribution. We knew about hepatitis A at the time, and hepatitis A was, in our opinion, was at the time quite severe. It's an acute disease. Patients would recover. And basically, I have seen so many of these individuals with hepatitis A, including my professor in London, who happened to go to India on a holiday. So it was amazing. Of course, patients present with jaundice, anorexia, vomiting, malaise, above quadrant pain, and basically, in summary, they feel terrible for about 3 weeks. They don't like, if they drink, they can't drink. If they smoke, they can't smoke. They almost don't want to talk to you. They just want to be left alone. So it's really quite miserable for about 3 weeks or so. But they will recover. There's no residual virus in the body. Excellent assays for screening for hepatitis B. We will still be able to actually find quite a high proportion of individuals who had post-transfusion hepatitis. So obviously there was another virus that we did recognize. And this virus was a challenge. We called it at the time non-A, non-B. It was quite a challenge because you couldn't grow it in culture or anything like this. And it took a biotechnology company called Chiron to actually basically take the bits and pieces of the genome of the virus in the blood and actually assemble it into a complete virus genome. And from that, they were able to actually develop an antigen, which then they used to pick up antibody for hepatitis. That virus we then called hepatitis C. That was a major discovery at the time. Then, of course, as you know the story, and that's where Professor Huru's discovery was, is in fact we found this large outbreak of waterborne virus infection. And it's not hepatitis A.
Thank you, Dr. Saroj Grover. His Excellency, Mr. M. Ganapathy, Honorable Ambassador of India to Kuwait, Dr. Abdullah Behbahani, Vice President, Kuwait University, Dr. Vidad Al-Naqib, Professor of Clinical Virology, Faculty of Medicine, Kuwait University. Sir, you already covered hepatitis E as well as I would do. Members of the Kuwait Medical Association and members of the Indian Doctors Forum, my dear friend, Dr. Ramesh Pandita, the President of Indian Doctors Forum. Now, I'm honored to be here and humbled by your hospitality and your presence here. Now, to start with, I will like to get the love and the respect for all of you from your home back to Kuwait, and to many of those who don't belong to India, to invite them, sir, to India. And I hope you make it very soon. Can I have the next slide? I also invite you to the Jannah of the India and the world, that is Kashmir, the beautiful gardens of Kashmir. And if you are next in India, and His Excellency also when he's in India, I'm going to catch him to come to Kashmir to see these gardens. Now, for at least last 2 decades, Kashmir has passed through some bit of difficulty. Can I have the next? And many of us made a journey out of Kashmir, and I've been in Riyadh for 10 years, and we have made our journey back to Kashmir. Next, please. And we did that because Kashmir is now nearly coming to normal, and you can see the tulip garden of Kashmir, where my grandson and granddaughter are enjoying the tulip garden of 5 million tulips, which was recently inaugurated, and that should give you, His Excellency, sir, that thing to come to Kashmir whenever you are in India. Next, please. Now, coming to the topic of hepatitis viruses and viral hepatitis, which is a major health problem in the world and also in the Middle East. The viruses of viral hepatitis are 5 in type, and none of them resemble each other, as you will see, except in one thing, that they cause hepatitis. Otherwise, they are different viruses, they are different size, they belong to different classes, and they have different structures, but except that they have one thing in common, that they cause hepatitis. Next, please. Now, the story of hepatitis E, which came up with the first epidemic, which I described in 1978-79, when I just finished my days of studentship, and this has completed 25 years, 2 years back, and all the researchers of the world who have really done their lifetime research in hepatitis E came up together to celebrate the 25 years of hepatitis E discovery, and I really had the honor to really inaugurate this conference in Delhi. And you would see the people who have really done exceptionally brilliant work, that's from the CDC, and this is from Karolinska, and you got the ICGB, and Dr. Purcell is there. So all these people really came up together to celebrate, and this was inaugurated by me, and finally the concluding remarks were given by Bob Purcell from the NIH, who's done exceptional work in the field of hepatitis C. And what I'm going to talk today is what happened in these 25 years to hepatitis E virus. Next, please. Now, just after I finished my training in gastroenterology, there was something very peculiar which was happening in the Indian subcontinent. There was a special relationship which was thought to be between viral hepatitis and pregnancy, and nobody would really invest or sure what's going on. And so I had interest in hepatitis right from there. And as soon as I reached home, there was a massive epidemic of jaundice which came in 1979 in Kashmir Valley. This came up right in the winter, and you can see the winter of 1978, where I'm really in these villages. And I took off from my work, went to the field with 500 staff work, and really did a house-to-house field work for months and months together with these 500 people. And this is how we would go and really talk to the people at their homes. And we estimated that in 6 weeks' time, there were 52,000 active cases of viral hepatitis, with about 1,600 estimated deaths. This, from a house-to-house study, showed unique clinical and epidemiological features. There was an exceptional increased incidence and severity in pregnancy, And this was a self-limited disease. We continued looking at it for years and years. It was self-limiting disease. And obviously this was negative for markers of hepatitis A, where the marker was just introduced that time, and markers for hepatitis B. And in a very challenging way, we said this is a new disease, should be called as the epidemic non-A, non-B hepatitis, different from the one, the post-transfusion non-A, non-B hepatitis. Next, please. And today we're going to discuss the discovery part of the hepatitis E virus, the agent in great detail. We talk about the disease, the global epidemiology, both East and the West, the diagnosis and the control, and the ultimate in the control is the vaccine, and future challenges for many of you who can take from here and uncover more about hepatitis E. Next, please. Now, the landmark papers in hepatitis E are really as they are. We put 3 challenging papers that this is a new disease in the American Journal of Medicine, another association of this disease with pregnancy, also in American Journal of Medicine, and then also told to the world that in a sporadic hepatitis, you got the same disease, what's called sporadic non-A, non-B hepatitis. Now, while we were really experimenting this to pass it on to rhesus monkeys, Dr. Balian at Moscow did something exceptional. He would not trouble the monkey, but he himself ate 9 fecal samples from viral hepatitis in Central Asia and was perfectly okay for 35 days. And on 35 days, he called me, he said, Sultan, you're talking nonsense, there's nothing going on with me. And he went up north in Russia, got very ill with disease, was in the ICU for many weeks, and he got the virus-like particle in stool and finally transmitted it to monkeys after that. And that's how the particle was known. And then it took another at least 7 years before the virus was cloned by Dr. Reyes. And with all this, a diagnostic test was available for the hepatitis C, and the epidemiology of hepatitis C grew leaps and bounds for many, many years. And the story now is really uncovering, but much more is to be uncovered. And recently, a very remarkable paper has come in New England Journal of Medicine from a French group that hepatitis E is not a self-limiting disease under some circumstances, particularly organ transplants. And if you get an organ transplant, you can get chronic hepatitis C, chronic hepatitis, cirrhosis, and stage liver disease. And this is a common manifestation in organ transplant recipients. And obviously, Dr. Purcell's story of defining the vaccine, and finally a Nepal trial which came in New England Journal of Medicine, that a vaccine is effective and safe for hepatitis C. Thank you for your patient hearing.